to today's webinar on opportunities and challenges for pharmacists in East Africa. My name is Genuine Desire, and I am delighted to be your facilitator for this session. We have an exciting and insightful discussion lined up for you today, featuring experienced panelists from the East African region. And whether you're joining us from the East African region or tuning in from anywhere around the world, we truly appreciate you taking the time to be with us. Before we dive in, let me go over a few housekeeping details. First of all, this webinar is being recorded and live streamed via YouTube. The recording of this webinar will be made available on our website. That's www.events.fip.org. During the session, you are free to ask any questions using the Q&A box provided. And you're also welcome to provide any feedback you have about the session or our webinars to webinars@fip.org. Lastly, I'd just like to encourage all of you who are joining us this evening for this webinar. If you'd like to become a member of FIP, please go to www.fip.org/membership_registration to join FIP and enjoy many of the benefits that we offer to our members. In addition to that, I'd like to share that we have a new translation feature on Zoom, and you should be able to get live translations to your preferred language. To do this, just go to the show caption button on Zoom, enable the translation toggle, and choose your preferred language under My Caption Language. As you can see, demonstrated using also the images on your screen. At this point, let's get started. It's my great pleasure to introduce our moderator for today, Dr. Aneez Rahemtulla, who is the National Executive Committee member for the Pharmaceutical Society of Kenya. Dr. Aneez will kick things off. Over to you, Dr. Aneez.
Thank you, Desiree, and welcome everyone. And wherever you're joining us from, I say good evening, Jambo. I think pharmacists must have a way to greet each other so that we have our own sort of code. So if you have an idea of what that code for hello or how are you or good evening or salam or kemcho or what's up or how you doing, that you think that pharmacists should use when greeting each other, please put it in the chat box so that we have some ideas, and maybe we can pass a resolution in Copenhagen that when you meet a pharmacist, you say XYZ. Great, my name is Aneez, and we are moderator for today. Been a pharmacist for very many years, not risking to give away my age. This is the program for today. I will introduce the speakers and myself, which I've already done. Then we'll have a keynote address on the issues of the East African region. Then we'll have a moderated discussion where our panelists will be given general and specific questions to answer. And then we'll have a presentation on the opportunity and challenges in procurement and supply chain management of health products. And we'll close with a wrap-up and conclusion by the team that is going to present to you today. I'm extremely delighted and hoping that we'll be able to achieve these objectives. One is to provide an overview of the pharmacy sector in East Africa. Secondly, is to discuss some of the challenges that we face in East Africa, and then share opportunities for pharmacists in the region. And if I find that the discussions are not going to fit these three learning objectives, I'll try and steer them back to meeting these three objectives. It is my honor, privilege, and pride to introduce to you Jocelyn. I'm not even going to try second names in this presentation. So I'm going to try and introduce to you the speakers with their first name. Jocelyn is a community pharmacist with several years of experience in community pharmacy practice and in education of pharmacy support staff, pharmacy technician. She's a pharmacy technician course supervisor. She's been a board member of the Pharmacy Regulatory Board's Pharmacists Council of Zimbabwe, and the past president of the Pharmaceutical Society of Zimbabwe, and also chairperson of the Community Pharmacists Association of Zimbabwe. She's a holder of the postgraduate diploma in procurement and supply chain and an MBA, and the current president of the African Pharmaceutical Forum, APF, which is the Africa chapter of FIP. Over to you, Jocelyn, to give us your input on this topic. Thank you.
Good evening, good morning. Hello, everybody. Greetings from the Office of the President of the African Pharmaceutical Forum. I'm Jocelyn Chaibva, based in Zimbabwe. But as African Pharmaceutical Forum, we work with everyone who is interested in pharmacy across the Africa region. Next slide, please. In my introduction, we're talking about the challenges, that is the topic, challenges and opportunities for pharmacists. I thought it would be important for us to look at ourselves and understand what is our role as pharmacists in the healthcare delivery services. According to FIP, we usually say wherever medicines are being discussed, pharmacists should be at the table. This is based on FIP concepts. The medicine itself should be safe, efficacious, and of good quality. And it should be available, accessible, and affordable. So our development goals as FIP try to address these issues. Next slide, please. The FIP development goals, there are 21 of them. But for last year, which is 2024, we're focusing on development goal 18, which is access to medicines and medical devices and services. Development goal 17 is antimicrobial stewardship. Development goal number 16 is communicable diseases. But it doesn't mean that we'll just be dealing with those. You realize that this might be the focus priorities or the priority goals for FIP, APF chapter. But we'll be looking at the other aspects which come into place and work together for better outcomes when you look at these three priority goals. Next slide, please. Right, our theme or our topic is on opportunities and threats. Well, I thought when I look at ourselves as pharmacists, there are a lot of factors which can affect the way we practice. And whenever we look at each section or each topic, is it a threat or is it an opportunity? I was looking at, I thought of local politics and policies. They can be a threat in the sense that when things change, there's instability and people are not able to practice their profession. But at the same time, it can be an opportunity where we talk with the politicians and come up with policies which improve the quality of service which we provide as pharmacists. And the regulations, sometimes we are always screaming about regulations, too much regulation, but some of them are a threat in our opinion, but they could also be an opportunity for us to improve the quality of service which we give to our clients. And it could also be an opportunity for us to develop the profession even better in a certain direction for better outcomes. Disease burden, whether it is communicable diseases or NCDs, they can be a threat because we might not have the resources to deal with the disease burden. But it is also an opportunity whereby we do research and try to get our patients or our people to get better services. So it can be an opportunity. So whenever you look at each situation, look at both sides of the coin. The farmers' workforce, are they adequately educated? If not, what can we do? That becomes an opportunity for us to develop better. The remuneration, how much are the pharmacists or pharmaceutical personnel being paid? It can be a threat if it's too little, or even if it is too high, such that the pharmacy supply chain might not be able to sustain it. It becomes unsustainable. So it can be a threat to our existence, such that people reduce the number of pharmacists they employ because they can't afford the remuneration. So there should always be a balance. Migration. When people leave their home countries, unfortunately, they usually take with them all their expertise, and there's no plowing back home. But if they plow back home, that becomes an opportunity for development, for learning what is happening abroad or across the borders. And that is an opportunity for us to develop pharmacy better. The migration itself, when they leave, we feel the pinch of shortage of staff. So migration can be an opportunity or a threat. So let's choose how we want to go. Support staff, they give us an opportunity to serve in more pharmaceutical matters. Sometimes we spend a lot of time counting tablets and so on. But if we have got our support staff which is well trained, then that will release the pharmacist to use their cognitive knowledge to educate the patients, to do other things to make pharmacy better. But if we haven't done our homework, we might feel they are a threat, they are taking our job. The same happens with the other healthcare professionals. The turf wars, whereby some professionals will think when you do clinical pharmacy, for example, you are doing too much clinical work, you are taking our job and so on, and yet our patients need us in our different professional areas. It should be an opportunity rather than a threat. Next slide, please. Geopolitics can also be a threat or an opportunity. Currently, we are having the issues of donor-funded organizations, which are creating a threat in some of the supply chain issues. And it can be an opportunity to get a job with the donor funder, and then we are able to promote pharmacy practice in our area. Or at the same time, it can be a threat. At the moment, I think a lot of you might have seen what is happening with the WHO and the organizations which were funded through the American system. It is a threat if we are relying on donor funds. But it is an opportunity for our governments to look more closely at the funding of the medical services and improve the quality. And us as pharmacists, we should be there to do our part. Then imports can be a threat to local production, or they can be an opportunity for the other people who do import, but there should always be a balance. And imports can be affected by access to foreign currency and exchange rates. Next slide, please. So the opportunities, when it comes to pharmaceutical product, what a pharmacist can do. The product itself should be efficacious, good quality, and should be safe. And which areas can pharmacists be involved? There's the research and development, which deals with the efficacy, quality, and safety, pharmacovigilance, clinical trials, and regulatory oversight. That's an opportunity. Those are opportunities which are open to us as pharmacists. Next slide, please. Then access to medicines, which is our development goal 18. We want medicines to be available in the right quantities and at the right time. They should be affordable to the users, and they should be accessible, that they should arrive at the place where they are needed at that time. So where can pharmacists come in to try and fill that gap? There's the procurement and supply chain issues. In hospitals, you can even have specialization. And the wholesales or logistics and distribution. Manufacturing, where you've got R&D. So there are opportunities there for us. Are we making the best use of these opportunities as pharmacists? Next slide, please. So the East African situation, which covers the four countries, Kenya, Tanzania, Uganda, and Rwanda. There was a research or a paper done by Mr. Holmes. What he came up with is the expansion of the population in East Africa is putting immense pressure on the health sectors in the East African community, both organizationally and financially. Such that, and also 90% of the products are imported. Hence, the stockouts can be very frequent. And this was well demonstrated during the COVID era, when we had a lot of stockouts because we had to rely on imports. Repairs of medical equipment is not always done. These are threats. This is the situation. And private sector involvement is therefore a crucial opportunity. But one of the challenges to address this is failure to access financial resources, and the regulatory controls could be a hindrance to progress. So we should look at the regulators, at the regulations to improve that. So that we improve access, we have advocacy. Next slide, please. So the opportunities which have been identified from this paper or from the research by Jeremy Holmes, foreign investment in pharmaceutical manufacturing, and I think other countries are also looking into national development strategies to have local manufacturing. Medical equipment production can also be done. Healthcare logistics systems can also be put in place to ensure that medicines arrive or products arrive in good time and in good quality. And the impact is to stimulate economic growth, so it affects the GDP. It will also improve access to medicines and be able to tackle the non-communicable diseases and the communicable diseases which you find here in Africa. Next slide, please. I'm almost there. So opportunities and challenges for pharmacists. The challenges and threats are actually an opportunity to evolve for the pharmacist to meet the needs of the changing landscape in pharmacy practice. There are things which are happening, the challenges like AI, they are talking about that. How best can we make use of that? Digital health, telemedicine, and advocacy for regulatory change will open opportunities for pharmacists. These are just a few of the examples which can, and it's not only for East Africa, it affects all of us as pharmacists, wherever we are practicing from. Next slide, please. Thank you so much.
Thank you, Jocelyn. A big round of applause for her. The interesting points you made. One is it's important to be at the table and not on the table. And just one, maybe let's not depend so much on foreign investment. Let's hope that we can provide conducive environments and enabling environments for local investment. I think those are maybe 2 points that I have. But very, very well presented. Thank you very much, Jocelyn, for your words of wisdom. I want to now introduce the panel. And the way I propose to do this is to introduce one individual, and he or she will give a brief overview on the pharmacy sector in their country. To start us off is Jacques. He is the board member for the Rwanda National Pharmacy Council. He's a registered pharmacist in Rwanda and has been its board member since 2022. He has got 7 years plus experience in the pharmaceutical sector and is well known for his passion in leveraging digital health solutions towards promoting good health regionally and internationally. He has recently been a speaker in the webinar hosted by FIP under the theme Embracing Technology in the Pharmaceutical Sector, an African Perspective in October 2024, and is currently the co-founder of HealthFlix Rwanda Assessed. Welcome, Jacques, and please tell us a little bit more about yourself and give us a brief overview of the pharmacy sector in Rwanda. Over to you, Jacques.
Yes, thank you, Brother Aneez. Allow me to call you brother. That's how family is made, family of pharmacists. My name is Jacques Tuyishimire, and I'm a board member of the Rwanda Pharmacy Council, Rwanda National Pharmacy Council. And briefly, I'll take you through an overview of how the pharmaceutical sector is really doing. But before I proceed, I would like to thank my previous presenter, my sister. And actually, briefly, Rwanda is, I think we know Rwanda. It is located at the heart of Africa. And actually, the pharmaceutical sector is part of the healthcare system, which is actually operating under the Ministry of Health, Rwanda. So, and specifically, the pharmaceutical sector is regulated by, yes, the Ministry of Health, but hand in hand with the National Pharmacy Council, which I'm representing on behalf of the chairperson of the National Pharmacy Council. And the pharmaceutical sector is made of pharmacists. That's all I can say. And so far, our registry has gone up to almost 1,400 pharmacists, which is quite a very good number. And so far, we have as well 12 pharmacy technicians. So 1,400 pharmacists registered in our registry, plus 12 pharmacy technicians. That's really a good workforce when it comes to leveraging the opportunities at hand in the pharmaceutical sector in Rwanda. So we have so many various opportunities for pharmacists here in Rwanda, and basing on the fact that the scope of pharmacy ranges from the regulatory arena, the community pharmacist, the wholesale pharmacy, supply chain management, hospital pharmacy. We have pharmaceutical industry, and currently Rwanda is appealing for investors to invest in the plants, the manufacturing plants for pharmaceuticals. And recently we've received the BioNTech, which is actually a great milestone to the country and the region and Africa as well. But also we are planning to have more investors coming in our country. So the pharmaceutical industry is really doing well with a good progress, basing on the fact that I would say that Rwanda is a safe country, security is good, investors are really welcome, and the investment window is really fine. We also have academia, administration, research, consultancy, and advisory, especially dealing with global health delivery. So these are opportunities that we have mainly in Rwanda, whereby various institutions work hand in hand to make sure that pharmacists, first of all, they are available at a good number, but plus they are also equipped to deliver when it comes to fulfilling the duties of pharmacists. And so far, as it's an overview, I would like to give a hints on challenges that we are facing currently. We are facing some educational and career advancement constraints, whereby we have limited scholarship opportunities. And this is a call to action for the FIP, to make sure that pharmacists can really have access to various scholarship opportunities. And as well, we have kind of a gap in terms of mentorship between the senior pharmacists and even those who have higher grades in pharmacy plus the juniors. So we need to find a way. I don't even think that it's an issue in Rwanda only. It's regional wise or even international wise. We need to bridge the gap between the senior pharmacists, the advanced pharmacists, and the juniors that are joining the profession. So I would like to end with sharing another constraint, which is about research and innovation barriers. There is still a gap in finding financial support while dealing with pharmaceutical research projects. This is for those who are already in the profession, but as well for those who are still in the training, in the pharmaceutical training, the students. They have an issue that there is no regional or international platform where people can have student exchange programs. And I think this can really be a call to action for FIP to find ways of bridging this gap so that the junior pharmacists, the student pharmacists, that they can really have more and more exchange programs so that we have a united vision across the globe. And as I conclude, I would say that the pharmaceutical sector in Rwanda is really doing well. We are open to training more pharmacists ahead, but as well, we are more open to collaboration between Rwanda and many more other East African countries, but as well across the globe. So I will end up by saying that we need just two things so that the pharmaceutical sector really might bloom, not just in Rwanda, but across the region, East African. We really need to have transformative pharmaceutical initiatives. We are living in an era of advanced technologies, like East African pharmacists or pharmacy bodies and organizations. What are we doing to make sure that we leverage these resources regarding the high advanced technologies, especially artificial intelligence? Another thing is we call to have a collaborative vision. How are we uniting ourselves across the East African region? Not just the East Africa region, but across the globe. Do we have a framework of sharing the vision as pharmacists across the globe? This is a little brief that I would like to share with you. Otherwise, over to you, Moderator. Thank you.
Thank you, Jacques. Thank you for those points. Good to know that Rwanda, such a small country, is moving so fast with the number of pharmacists and the roles that you play in pharmacy practice in the country. In terms of opportunities for exchange, the IPSF, International Pharmacy Students Federation, has lots of opportunities for students to do exchange. Not lots, but they have opportunities to do, and they have their own Africa chapter Students Congress coming up in Zimbabwe, I believe, and also the World Congress, the IPSF World Congress, is also being hosted in Kenya in August. So these are good opportunities for students to meet, network, and also share ideas. In terms of pharmacists getting a chance to share opportunity, let me take this opportunity to invite all East African pharmacists to the Kenya Pharmaceutical Society of Kenya Annual Scientific Conference happening in June in Mombasa, Kenya. And we can look forward to having a breakout or a keynote discussion on opportunities for pharmacists in East Africa in that conference to further engage on this topic. Thank you. Next on our line of distinguished speakers is Dr. Juliet Konje. In Kenya, we have the privilege of being called doctor. She's the deputy president of governance at the Pharmaceutical Society of Kenya. Dr. Konje is a distinguished professional with over 2 decades of experience in project management, global health business development, health policy and regulatory affairs. And she currently serves as the Senior Program Manager for Africa Partnerships and Growth at the United States Pharmacopoeia Convention, USP. Juliet develops regional partnerships, strategies, and fosters collaborations with NGOs, private sector companies, and donors across Africa, focusing on pharmaceutical manufacturing, quality assurance, and pandemic response initiatives. Dr. Konje, please give us a brief overview of the pharmacy sector in Kenya.
Hi, Aneez, and hi, everyone. I hope you can hear me. Just checking the sound.
Yep, we can hear you.
Good. Good evening, everyone. Just to give you a brief of the pharmacy sector in Kenya. So currently in Kenya, we have about, let's say, under 5,500 registered pharmacists, those who have completed their training. And we also have quite a number of pharmacists still in training, as we have about 9 schools, pharmacy schools currently in Kenya. Our pharmacists work in very diverse sectors. They are the conventional sectors that my brother Jacques has already mentioned, but I also wanted to mention that the Kenyan pharmacists has really gone out to diversify and use their skills. So we have pharmacists who are actually policymakers or politicians. Just like the president said, I think her first point is that pharmacists should be on the front line for policy making. We have pharmacists in the food industry. We have pharmacists in the cosmetic industry. We have pharmacists in the veterinary sector. We have pharmacists in the medical devices sector. We also have pharmacists who are running patient support centers, especially for patients managing chronic illnesses. And as we mentioned, we have 9 schools of pharmacists, so we have quite a number of pharmacists also in academia. And also clinical trials. As you all know, Kenya is also known for its pharmaceutical manufacturing capability. We have over 30 registered pharmaceutical companies, and therefore we have also pharmacists playing critical roles in those pharmaceutical companies. The pharmacy practice in Kenya is regulated by the Pharmacy and Poisons Board of Kenya. We do not have a pharmacy council, but we do have the Pharmaceutical Society of Kenya. So the Pharmacy and Poisons Board regulates by registering and licensing the pharmacists. We get our annual licenses every year to practice. The Pharmaceutical Society members are about 3,000 and rising. And we face, I'm sure, similar challenges to other countries within East Africa. But just to mention that the healthcare model within Kenya is changing very fast. And this is affecting how we practice, especially in a community practice. We have also seen not so much or limited innovations on how we practice pharmacy over quite a long period of time. There is also need to upgrade our curriculums to meet this ever-changing landscape within healthcare. So just like the president mentioned, there are quite a lot of opportunities that are coming up, but are the pharmacists well equipped? Do they have the right skill set to then meet those opportunities or to fit within those opportunities? I'll give an example is when I went to pharmacy school, we were not trained on how to deal with pandemics, but you can see now the pharmacist has to deal with pandemics. We had COVID, and you've all had that, you know, even Ebola, Mpox. So there's a rising case of pandemics, especially within the East and Central Africa region. And the pharmacist is expected to also be part of the team that manages the pandemics. Back to you, Aneez.
Thank you, Dr. Konje. Being from the same society and being from the same country, I have the pleasure of knowing Dr. Konje really well. I think a very good overview of what the challenges are. But to me, one of the main challenges we face in Kenya is the role of the pharmaceutical technologists, but that may be a topic for another day. Our next speaker is Kidu. He's the Executive Director, Ethiopian Pharmaceutical Association. And he was born, raised, and followed elementary, secondary school education in the central zone of Tigray, Adwa town, Ethiopia. You can Google the location. He graduated B.Pharm in 2005 and a master's degree in pharmacoepidemiology and social pharmacy in 2010 from the Addis Ababa University School of Pharmacy. Kidu, please give us a brief overview of the pharmacy sector in Ethiopia.
Thank you, Aneez. Joining this webinar from Addis Ababa, it's almost about 7:30 p.m. in Addis Ababa. Thank you, FIP, and other colleagues here for the opportunity. Of course, Ethiopia is a vast country with now over 120 million population, and the pharmaceutical sector is equivalently very expanded. So we have the pharmaceutical sector in about I can categorize it in about 7 subsectors, where the board members or the executive committee members of the Ethiopian Pharmaceutical Association are also nominated from. We have 7 executive committee members, and they represent the subsectors when they are elected to the executive committee. So let me start with the first category, which is research and academia, where we find many of our professors, PhD holders, and master's holders, or the academia community as a whole. So we have more than 45 schools of pharmacy, public plus private. We have around 35 public schools of pharmacy and more than 10 private schools of pharmacy in Ethiopia. And currently, we are working to have an association of schools of pharmacy in Ethiopia, so that they can deal with academic, curricular, and other education-related issues in a concerted manner. The second category in the pharmaceutical sector is hospital pharmacy, or I can better say health facility-based pharmacy, where it includes hospitals and health centers. We have are about 400 hospitals which have at least 2 pharmacies, inpatient and outpatient pharmacies, which are all run by pharmacy professionals. And we have also close to 4,000 health centers having at least 1 pharmacy in their premises. The third category or third subsector in the pharmaceutical sector is the community pharmacy, and this is also very extended. Currently, we have as a country more than 12,000 private community pharmacies and drugstores added. So these are spread all over the country. Of course, most of them are concentrated in the capital, it's obvious, and next to the capital in regional cities or towns where there is more opportunity, more population. And the fourth category is pharmaceutical manufacturing, which is also currently, which has got highest attention from the government, and it is being supported with industrial parks and other incentive packages for local pharmaceutical manufacturers, ranging from provision of fund and other issues, and customs clearance and other attractive incentives. So we have around 25 pharmaceutical industries or pharmaceutical factories in the country, having different production capacities. And the fifth subsector in the pharmaceutical sector is, and of course the most extended, is the pharmaceutical supply system or supply chain management system. We have 1,125 wholesalers and 1,148 pharmaceutical importers in the country, added both close to 2,300 pharmaceutical importers and distributors in Ethiopia as a whole, ranging from the capital to regional cities. This doesn't include government or public import and distribution agents. We have the Ethiopian Pharmaceutical Supply Service under the Ministry of Health, which is very extended, and it supplies essential medicines to most of the public health facilities in the country, with around 16 hubs geographically located all over the country. And the sixth subsector in the pharmaceutical sector is the pharmaceutical regulatory system. So we have the Ethiopian Food and Drug Authority, which basically regulates only food and pharmaceutical products. It doesn't regulate the pharmacy workforce, and it doesn't regulate the service. So the pharmaceutical regulatory system is the sixth subsector. Pharmacy workforce or pharmacists are basically regulated by regional health bureaus, or a regulatory wing at the regional health bureau, or autonomous regional regulatory bodies for health professionals. That is how it is being done now. I will raise it at the end as a challenge. The sixth one is pharmacy service leadership. or the pharmacy professionals at the health system. That's what I want to say, and what the Ethiopian Pharmaceutical Association looks into it. So we have the Ministry of Health, we have the Pharmaceutical and Medical Device Directorate or Lead Executive Office at the moment. We have also health bureaus having pharmacy directorate or department. We have around 12 regional states. Ethiopia is, as you may know, federated state, and so we have around 12 regional states. These regional states have their own pharmacy department or pharmacy directorate. So this is the seventh subsector. So this is how the pharmaceutical sector is set up in this country. The challenges, certain challenges. We don't have pharmacy council yet, and we don't have a separate entity that regulates pharmacy professionals or pharmacy workforce in the country, starting from the education. I mean, from the university or colleges up to deployment and retirement. It is all done by the government. So I call upon FIP and other regional sister associations and other organizations to help us in advocating for the establishment of Health Professional Council as a whole and Pharmacy Council in particular. This basically enables us, the Ethiopian Pharmaceutical Association, to take a better role and to regulate the pharmacy professionals in a more passionate and compassionate manner. That's very important. Second thing, remuneration is very low for pharmacy graduates, and I don't think it's also enough support their life at this time. It's not. So we need also to work together in this area to advocate for better opportunities for our professionals, so that they can be better professional brothers and sisters for their colleagues in Ethiopia and elsewhere in the region and globally. Thank you so much.
Thank you, Kidu. That was very comprehensive. 7 sectors, very good way of describing the sector. I'm amazed with the number of importers and wholesalers being almost equal. And I was just wondering whether you can be an importer and a wholesaler at the same time, but that's okay. We can answer those questions later on. The last panelist that we have to briefly introduce himself is Stephen. Stephen is he's from Uganda. Stephen is a pharmacist. He's also a lawyer, serving as the secretary of the Pharmaceutical Society of Uganda, and he is a lecturer in the Department of Pharmacy at the Makerere University. Before joining academia, Dr. Lutoti served as a regional inspector of drugs in the National Drug Authority and a research officer in the Ministry of Health in Uganda. Dr. Lutoti received recognition as Pharmacist of the Year in 2021, 2022, and 2023 under the Ministry of Health Heroes in Health Awards. His impact in society has been manifested in the innovations that he has developed, the students mentored, interprofessional collaborations, advocacy and consultancy works done, and the patient care-oriented initiatives over the course of his practice. His research focus is on governance, health systems, product liability, law, and development of natural products that addresses ailments of common occurrence, also known as mitishamba in Kiswahili. Before you start, Stephen, please tell us how you are going to bring Migingo back to us, and then you can tell us a brief overview of the pharmacy sector in Uganda.
Thank you so much, Nazi, and colleagues. Good evening, good morning. Per medicatum saviam. With medicines we serve, as you're well aware, as the pharmacists, our expertise is on the drug molecules, and everywhere we are to make impact is because of this expertise. Uganda is a very friendly country, being at the center of East Africa. We welcome neighbors from Kenya who are on our west, and in the north we have South Sudan. In the west we have Democratic Republic of Congo. Southwest there also we have Rwanda, Burundi, and we have Tanzania. So we are at the center, and we welcome everybody. This is our country. So the Ugandan, just to give you an overview of the Ugandan pharmaceutical sector, is that we have a market that is one largely on relying on imports. So 80% of the medicines that we are using in Uganda, we actually import, and about only 20% is what we do the manufacturing. However, our sector has grown over time, and the government has done initiatives like Buy Uganda, Build Uganda, in order to promote the local manufacturing sector, and also embracing the spirit of East Africa as a region. We embrace whatever is under the East African Common Market Protocol, and we are very open to ensure that we work closely across the region with everybody. In terms of numbers, we have 1,900 pharmacists at the moment who are on our register, who are members of our Pharmaceutical Society, and these have to go through a pre-internship exam. The primary qualification is a Bachelor of Pharmacy for you to be considered, and this have to go through a pre-internship examination that is set by the Council of the Pharmaceutical of Uganda, and then you undergo an internship for 12 months, 6 of which are mandatory in a hospital setting, and then you undergo a post internship exam, that is a pre-registration exam, to test you on practice questions. The first exam is just to check whether you have ever been in any pharmacy school. So we have that, and we have also a national curriculum for pharmacy, Bachelor of Pharmacy program, which is under the stewardship of the National Council, Uganda National Council for Higher Education, and working closely with us as the Pharmaceutical Society of Uganda during the curriculum development review, and we make our inputs. However, of course, there is a gap that ultimately the National Council for Higher Education does the approval, and some of the programs or institutions can be approved sometimes against even our recommendations, but we have continued to engage with the National Council to ensure that they align. So consequently, we have 7 universities that are approved to we have got the issue of dealing with political challenges during the approval of some of the
I think Stephen is breaking up a little.
Okay.
Dr. Aneez, maybe you can.
Yes. Okay. Okay.
Stephen, is your network stable now? Are you able to?
Yeah. I'm back now. I'm back.
Okay, good. Go ahead.
Yeah. So we have that. We have a national curriculum as pharmacy. And just also to give you an overview is as far as our regulatory framework is concerned, is that we have Uganda. In Uganda, we had what we call the Pharmacy and Drugs Act, a very old law of 1970, which we are still actually following. It is called the Pharmacy and Drugs Act, and this is proposed to undergo some review amendment, and also from this law, it is what establishes the Pharmaceutical Society of Uganda. And then from this law in 1993, there was a change where we were able to form a new entity called the National Drug Authority. That is the agency that now regulates drugs. And then the Council of the Pharmaceutical of Uganda regulates the professionals. And then we have a pharmacy board under still the Pharmacy and Drugs Act that deals with only the function of registering. So adding members who have been qualified by the Council of the Pharmaceutical of Uganda to be added on the register. And then there is a disciplinary committee also that oversees issues of discipline. So all this under the Pharmacy and Drugs Act, and then ultimately we had the National Drug Policy and Authority Act that established the National Drug Authority, our drug regulatory agency, whose law is also, this law is also under amendment. And we are to have a new law that expands the mandate of the National Drug Authority from not only handling drugs, but also handling medical devices, cosmetics. Controversially, I think we had issues to do with food, but we have another agency called the Uganda National Bureau of Standards that is also mandated to develop standards. So we have had at times challenges dealing with things like medical devices where you get approvals from the drug authority, then another agency also needs to look into them. So our players sometimes have gotten challenges in that area, but we believe through amendments of the law, all this will be streamlined. We also have a national medical stores established in 1993 that is mandated to look at the issue of procurement, storage and distribution of medicines in all public health facilities across the country. And our health setting is that we have the public and of course the private sector, and then there are those which are not-for-profit entities, and all this must be served. They are all under the stewardship of the Ministry of Health. So within the Ministry of Health, we have a department of pharmaceuticals and natural medicines, which has grown over time because it started as just a unit within the clinical medicine, the clinical services department of the ministry. But we are hopeful that we will get a fully-fledged directorate with time, and also as a department to ensure that we have full representations even in the top management of Ministry of Health. We have a 10-year roadmap to improve the supply chain of pharmaceuticals in the country, and this goes up to 2032. And we have a national medicine policy in place emanating from our national health policy, the first policy in 1999, and then there was a revision in 2010, and we have last year had another one, the National Health Policy 3, and basing on the National Drug Policy and Authority Act, the law that established NDA, whose function was to ensure implementation of the National Drug Policy. We had the first National Drug Policy in Uganda in 2002, and then this was revised in 2015. So Ministry of Health has been using this national medicine policy now too. This is the current policy we have to develop strategic plans over the next 5 years, every 5 years, and then review. And this is what has been guiding us as a country, setting priorities. Our community pharmacy setting has been going through a lot of challenges because we are under attack by all manner of people to handle the drug molecules who are not qualified to handle the drugs. And we feel totally unsafe that people who do not know anything about medicines are the ones who want to be in charge of drugs because they are the investors and they are setting the terms, and we feel this is not right. We believe that sectors like retail pharmacy settings should be owned by pharmacists, and as a society, we are pushing in this direction, but also we recognize the spirit of ensuring that we work collaboratively with others for investment purposes in our country. We definitely have challenges of mixing up wholesale and retail of medicines in the country, and also the issue of veterinary medicines being handled in a manner which is not proper in a number of areas where we are having challenges of our colleagues, the veterinarians, who actually hold the misbelief that I think they do not need a pharmacist even to supervise their premises and so on. However, this has been demonstrated through our advocacy and engagement that one, the person who is properly qualified to inspect medicines is a pharmacist, and also the person who can oversee the manufacture and also oversee the supply of all medicines is the pharmacist. That albendazole, whether you give it to a dog, you give it to a cow, or you give it to a human being, interest is in the drug molecules. That when there is gross resistance among the beta-lactams, the microorganism will not say that, you look here for me, I'm in the animal, and therefore this antibiotic is safe. And so we are here as pharmacists, for us as PSU, the Pharmaceutical Society of Uganda, to ensure that the molecules are safeguarded. We have had challenges as a country in terms of our interns who finish the university and then they undergo maybe our pre-internship examinations and they need to be deployed in different facilities. The priority, of course, has been to be deployed in government facilities. However, the numbers have surged, and if you were following the news, the trends is that we have had some of them stay at home even for a year as they wait for the government to officially deploy them in different facilities. So we take different initiatives to see maybe how best they could start off and they are able to get exposures. Finally, maybe is to talk about the issue of ring fencing. We have our colleagues, our medical doctor colleagues, or I think because of the historical imbalances, they have dominated the sector that makes it very difficult even for our colleagues to get deployments. We have approved structures to what we call a health center for, but filling this in this public health structure has been a tug of war. Many places remain not yet filled. We feel we have been squeezed so much to the extent that we went to a body called the Equal Opportunities Commission as professionals together with other members of the health professionals to remove aspects of ring fencing of administrative positions like hospital directors and district health officers, and we feel these are administrative positions that are not clinical, and the pharmacists must be in charge as well, given opportunity to be in charge, and let the interview panel determine who the best person is. So you need to share with us your experience in that, but also feel as we have consultants in other fields, even within the hospital settings, we expect to have pharmacists as consultants and senior consultants in their specialized areas. And we are working and looking forward to having all these things done. So as we keep interacting, and we need to put all this into perspective, that we have a lot of issues that are going on within our sector, but we are very optimistic. Ugandans are very active people. If you follow the news during COVID period, our own past president, Professor Ogwang, developed a remedy called Covidex for helping patients during the period of COVID. And we are very innovative cadres in this country and accessible. I thank you and look forward to more interactions with all of us.
Great, thank you, Stephen, for those insights. Very comprehensive, very well articulated, and it seemed you are just reflecting on what the Kenyan pharmacist is going through. We have the same challenges, the same fights that we have. It seems like pharmacists everywhere seem to need to carve their own space and find their own niche. We're running short of time. I'm going to change the course of this discussion a bit. There were specific questions which I don't think we'll do justice to in the little time that we have. So I want to give you each of the panelists. I want to give you 2 minutes each to speak about what you feel are the opportunities for the pharmacist, not in your country, but from your country going to other countries in East Africa. What opportunities do you think we have going out? You have talked about the challenges within your country, or if you have opportunities within your country for pharmacists which your own pharmacists cannot manage, and you feel you need the support of pharmacists from other countries, you can state those as well. So there are also some questions which are in the Q&A tab. Take this opportunity to see if you can answer any of those questions. Please do that. The question about CPD points, I think, has been answered. If you look in the answered questions, all the CPD questions are answered, because and so that we did not take any time in answering the CPD questions. So I'm going to give you 2 minutes each. We'll start with you, Jocelyn. What opportunities do you think there are for pharmacists from the region in neighboring countries or within a country for neighboring pharmacists? Jocelyn?
Thank you so much, Aneez. When we look at pharmacy practice, it's and what is happening in the region, it's a very similar. We have similar problems and similar challenges. What I see as an opportunity is for regional cooperation. Such an example which comes to mind just off the cuff is a regulatory, where we have got in the southern region, we've got Zazibona, whereby registration of medicines is there's coordination, there's harmonization, and that can also happen throughout the region. And as such, we have an opportunity there. And when it comes to education, we need to get together and come up with a curricula which tries to address our problems or our situations more or less the same way, because we find that the disease patterns are generally the same, and our concerns and even our challenges in terms of financials and so on. it's an area which is a problem for all. Maybe going forward with harmonization, we need to even look at regulatory in terms of registration of the professional himself, the curriculum, and at this point I can talk of production. With the region, we have AMA, and which is now in the region, and it can be utilized by and shared by all the pharmacists within the region. It is an opportunity. Thank you.
Thank you, Jocelyn. Jacques, again, to opportunities that you think are available to the pharmacist. Jacques?
Yes, thank you, my brother Aneez and the rest of the team. So far, I will just base on 3 elements. First of all, the opportunities that are available in Rwanda for sister councils or pharmacists from the region and even the global community. The first element is that our country is so well regulated when it comes to the rule of law, when it comes to the merit-based achievements. Rwanda is a safe country that is open to investors. So for pharmacist investors, or for some group of pharmacists who can really be willing to invest in Rwanda, be it in the manufacturing, I would say, aspect, Rwanda is really a good opportunity for the region and across the globe. So we are very open to investment. The registration is smooth. The facilitations are really good. So that's the first thing. The second thing is the coordinated system as we carry out the activities. And recently we've had an outbreak of Marburg. And because of the Ministry of Health, which has a strong regulatory and coordinated system, in less than 30 days, the outbreak was put on hold, and it's been 2 months without even a case of Marburg case. And the Secretary General of WHO came to Rwanda for that amazing experience, and Rwanda has been graded at the maturity level 3 of Rwanda and Food and Drug Authority, which shows that we have a well-coordinated system, but as well we have an ecosystem when it comes to healthcare that is stable. So for any initiative that people are willing to carry out in our country, or any investment that people are willing to really do, it is stable, security is good, and the system is well coordinated, but as well it is merit-based, not the other way around. Those are the opportunities that are available in our country. Thank you.
Thank you. So along with Arsenal Visit Rwanda, you can do Invest Rwanda. Great.
Definitely. We have visitrwanda.com. Go and visit visitrwanda.com. It's really fascinating.
Excellent. Dr. Konje, opportunities for the pharmacists?
Yes, thank you, everyone. Opportunities for the pharmacists, I will talk about emerging needs in the healthcare landscape, especially relevant to the pharmacists. So, as I already mentioned, clinical trials is becoming a concern within the continent, and so we need pharmacists to step into this space. Regulating complex molecules such as biosimilars, those are areas that are still quite wanting. And as you know that more innovations are coming with new medicines, so we need to also upskill. Integrating PV in public health programs. There are quite large public health programs that are running in our countries. We have the TB program, HIV programs, but we see not much pharmacovigilance under those particular programs. I think there's also an opportunity, and just as the president mentioned, if pharmacists are active in developing the policies, then these policies can be developed to integrate pharmacovigilance into our public health systems. There is opportunity in artificial intelligence and machine learning. We have quite large databases within our public health systems. We can use these databases to monitor patient outcomes that can inform our drug utilization as a country. As you know that supply chain is a big issue, and countries are struggling. Countries like the ones in East Africa are struggling with budgets. You're seeing what is happening with donor funding. the constraints are only going to get worse. Therefore, we cannot afford any wastage when it comes to supplies. And I think this is the time now that even pharmacies should advocate for pooled procurement, even within their countries, within their districts, within their counties. But we can see even at continental level, even at EAC level, we can start talking about pooled procurement mechanisms. We can try and pilot some of those and document and see how they work. Vaccine manufacturing, our colleagues from Rwanda has talked about. Vaccine manufacturing is becoming a big discussion within Africa. As you know that some countries are going to get wind of Gavi. Recently in Kenya, we saw that we had shortages of vaccines. So our pharmacists, as we are right now, are we skilled enough to get into vaccine manufacturing, even if it is on fill and finish? So among many opportunities, but I see those are the ones that they are the low-hanging fruits. Now, in terms of upskilling, I want to give an example of a model. The Rwanda, the EAC Regional Center of Excellence for Vaccines, Immunization, Health and Supply Chain Management. I have to read it because it's such a long name, and it's under the University of Rwanda. So they are currently funded. They are donor funded, and mostly they take nominations from countries who are nominated by governments. They are still doing courses, but I would say in small scale because it's as much as the funding that they get. But this is a model that if it is upscaled, if our governments can pull together, then we can have regional centers of excellence within the EAC countries that can do trainings, just the way we have regional centers of excellence for regulatory functions. So I think it's a model, and if you go to the Regional Center of Excellence website, you will see that they have professional courses like on cold chain management, supply chain, emerging skills that are required. So I think that is a model that can be upscaled within EAC to upgrade ourselves so that we are able to meet the emerging needs. Back to you, Aneez.
Thank you, Dr. Konje. Those are quite insightful opportunities for the pharmacist. Next, same question to Kidu. 2 minutes, please. We want to carry on with the program. 2 minutes to Kidu regarding opportunities you feel that the pharmacist has in your country from outside or from your country to outside. Kidu, are you there? Okay, while we wait for Kidu, I'd like to give this opportunity to Stephen. Stephen, can you take the...
I'm on, sorry.
Okay, there we go. Kidu, go ahead.
Thank you so much. I will make it short, actually. Yeah, regarding the opportunities, I think in Ethiopia, there is a good opportunity for higher education opportunities because, as I mentioned earlier, we have more than 45 higher education schools for pharmacy professionals. So that's one opportunity for our colleagues in Africa. That's one thing. The other thing is investment opportunity. Of course, for pharmacists who want to engage in pharmaceutical manufacturing, there are very attractive investment opportunities. So this can also be considered. And job opportunities, especially for high caliber pharmacy professionals in the area of pharmaceutical manufacturing. There are many experts I know working here and in development partners as well. So these are the opportunities here in from the Ethiopian perspective. But as a region, when we see what opportunities are there out there in Africa for pharmacists, especially for Ethiopians and for others as well. So what is the job opportunity? I know many colleagues working in Kigali, Rwanda, and other regions of Rwanda, and in other African countries as well. So I can see, or there are job opportunities for Ethiopian pharmacists out there. That's one thing. The other thing is the opportunity for we pharmacists and for curriculum harmonization and ensuring quality of pharmacy education by making or by strengthening our network and consultations. That is very important. The other opportunity that we have is the African Medicine Agency, which ensures harmonization in pharmaceutical regulation, and that means pharmacy professionals or pharmacists can have opportunity anywhere they go in Africa once this agency starts is functional. The other is African free trade, which is also important for pharmacists aspiring to invest in the area of pharmaceuticals and even beyond. And the last point I just want to make is that, of course, these agencies are ours. When I say ours, it is African agencies or African institutions, but because of historical issues or whatever, we have the African Union here, we have the African CDC, and we have also the UN Africa in Addis Ababa or in Ethiopia. So these are also opportunities for pharmacists working or for our colleague pharmacists from neighboring countries and all over Africa. Thank you so much. Please.
Thank you for that insight. Good point to note is that a lot of headquarters are in Addis, and therefore a lot of opportunity in Addis for leadership position. Last but not least, opportunities, Stephen, and kindly turn on your camera when you're speaking. Okay. Stephen, are you there? Or?
Yes, I'm there.
Okay, go ahead.
Okay. So the opportunities we have are immense, as our colleague shared, Jocelyn, sharing what FIP stated. Of course, wherever there is a molecule, drug, there is a pharmacist. So that is where our opportunities we should look at as pharmacists who are really keen, either in form of raw materials. Anywhere they mention a drug, that is where you fall. And so we trace all this through the drug logistic cycle, and at each level, there are opportunities. I want to call upon every pharmacist who is in attendance to examine the drug logistic cycle and see all along this trend. When you do a reflection, you will not stay home or lament that I have nothing to do as a pharmacist, because there are so many opportunities along this chain. But just to point out, especially within our region, as pharmacists, in Uganda we said, let us fight for ourselves. There are so many things that are happening, and nothing will come to us on a silver plate. The area of entrepreneurship, we should not be pharmacists who are actually waiting to hang certificates in people's premises. If we continue with that trend, then we shall continue lamenting. We must be pharmacists who are actually doing things. Time has come. In the past, we used to be paid for what we know. Now we are paid for what we do. As a pharmacist in the region, if you continue with the trend of thinking that because you know something you should be paid, you are going to join the queue of those that lament because they have so many books, they have so many papers, but they are doing nothing with the papers. So join the queue of those who do. Start small. Entrepreneurship is the way to go. Another area as a pharmacist to think about is the issue of innovations. We are pharmacists, well equipped with knowledge in chemistry, in pharmaceutics, and all these other subjects that we have done. And we have experiences, we have mentors around us. We should be humble enough to ensure that we apply this knowledge. We should be innovators. There are opportunities in innovation. Innovate something and start working on that. If you can't do that alone, work with others. Transform that idea into some product or some service. We look around everywhere, there are challenges, and they need us to provide solutions. Let's not be lamenters. There are opportunities in innovation. Look at the herbal manufacturing sector, for example. Yes, we have all this knowledge that drugs are derived from plants, animals, microorganisms, and so on. We can go on and think all this, whether as crude drugs, whether as isolated purified compounds, or their modifications. Yes, this is important, but we need to package this information into a product. At worst, boil mango leaves, filter. If you forget your pharmaceutics, you don't know any colorant, you don't know any sweetener, you don't know any thickener, and anything that could make the product aesthetic properties acceptable. Pack for us those mango leaves and tell us that this is manufactured by pharmacist so and so, who was trained in this university, and let the public know that there is someone called a pharmacist. I wish that we all get inspired by the story of John Pemberton, one of us, the American pharmacist who made the Pemberton tonic. And from his innovations, he wanted to counteract the effects of morphine because of the addiction. And we know that the John Pemberton tonic has become a great inspiration for all of us. We have today Coca-Cola and other products that have come up because of such innovations. As a pharmacist, should it be said of us, like as it is in the scripture, that all foolish Galatians, who has bewitched you? Nobody has bewitched us as pharmacists. Let us apply the knowledge we have and develop some products from this knowledge. Whether it is a drink, please do that. Don't only look at going to work in that agency that is dealing with foods and so on. If it is a medicine, let's not only look at how to deal with those brands from Europe, from where, or locally manufactured. Please, let's do something in that line. There's an opportunity in that area. There's an opportunity for us as pharmacists in the area of training and capacity building. Many of us have become so comfortable with our first degrees. Challenge yourself. There is room at the top. Why don't you add on additional qualifications? Help us to improve that supply chain with additional knowledge and skills that the average pharmacist does not have. Why don't you go back to school? But also, why don't you use that knowledge, develop for us some short programs and share with us? We all get equipped across the region. As a region, I'm sure we are short of people with expertise to lecture as these universities are coming up. Where is the expertise? Who is going to lecture that pharmaceutical analysis, pharmacognosy, pharmaceutics, all those subjects? Who is going to lecture them? We need pharmacists. Every profession can only grow if it self-propagates, and we must make more disciples who will carry on our genes to ensure that we have molecules that are put in proper use. The area of research and development, R&D, of course, there's a lot that we need to explore. Just develop passion as an individual and say, let me focus myself in this area. There are a lot of opportunities as far as that area is concerned. As pharmacists, we need to work on the issue of having a forum that brings all of us together in the region, in the East African region. In the past, we had the East African Pharmaceutical Society. My interaction with Dr. Luis from PSK, he allowed and we formed a WhatsApp platform where some pharmacists have joined in here and there. But we need a formal system. Let us have an East African Pharmaceutical Society. Let us have standards that cut across the region, and let us have one voice on issues that will advance our profession and our practice in the region. I thank you so much. There are quite a lot that I believe we can do as the pharmacists. I have a product called Elocof. Those in Uganda know that this is the product by Dr. Totti. It is in the pharmacies. I do not want to teach what I don't do. Please, pharmacists, let's do something.
Thank you. Thank you, Stephen. All I say is hallelujah. I look forward to seeing you in Mombasa in June. We hope we can have a East African Society meeting at that conference and share some ideas. As we go along, we're going to have a presentation by Nicolas. He's going to talk about procurement and supply chain. He's a procurement and supply chain management expert from Empower Swiss in Switzerland. And after his presentation, each of the panelists will give us a parting shot, and then I will hand over to Genuine, who will wind up and also tell us a little bit about the work FIP is doing about curriculum development. So over to you, Nicolas, 10 minutes.
Okay, thank you very much. I'm not currently in Switzerland, but I'm in Thailand. Anyway, let's start the presentation. Okay, so now we're gonna check about the opportunity for pharmacists to work on the procurement and supply chain management. Just for your information, we call that PSM, refer to procurement and supply chain management, and you have here a short definition, but in fact, it's a succession of a lot of activities from the supplier to the end user. And as my colleague mentioned earlier, these activities refer to the procurement, to product selection, to quantification, to storage or cold chain storage. So you have a lot of activities in the procurement and supply chain management. Next slide, please. So what you need to know, it's not because you are a pharmacist that you go automatically or you go easily to work on the supply chain management. As you can see on the right side, the red box, the Ministry of Health, I think it's the one of Kenya, said, when you use a nurse or a physician or a pharmacist as a logistician, you lose a nurse, a physician, or a pharmacist, and you don't get a good logistician. Why? Because it's not only being a pharmacist that will give you or open the door to manage a supply chain. The supply chain is very, very complex. You need to become very familiar with many things, not only medicines, but other stuff, like, let's say, health equipment, computers, etc., etc. You need to have a knowledge of all these kind of things and a lot of skills. You need to become some kind of a leader. So let's have a look on the next slide, and you will better understand. When you become a procurement and supply chain expert or manager, as a pharmacist, for example, you will need to understand not only how to select a product, how to quantify a product, to procure or to store a product, or a pharmaceutical. You will need to know about cars, about computers, about health equipment. You will need to know how to hire a consultant and to work with a consultant, which is not a pharmacist. You will need to recruit some companies who are renovating or building an hospital. So it's very complex, very complicated. And not only your MBA in pharmacy is enough. Next slide, please. Here you have a list of 67 pages of competencies required to manage a supply chain. So if you are a little bit curious, you will go to this website, People That Deliver, and you will see all the competencies required to manage a supply chain, a complete supply chain. You will see it's amazing. Next slide, please. One of the major challenges in the supply chain is a lack of human resources, not only in your country, but all over the world. In Southeast Asia, in West Africa, in East Africa, in Europe even. And the problem is you need you need human resources, but at the end, you see the small guy at the end, it's what you have. And sometimes you don't have choice, and you have to take some pharmacists, some nurse, or some people around to manage the supply chain, but they are not well trained for that. So the lack of human resources is a very sensitive point in the supply chain. Next slide, please. If you have a professional who is not well trained on the supply chain, it will be catastrophic. You see, the Global Fund. The Global Fund is an organization. You probably heard about Global Fund, who provides some funds to fight HIV, tuberculosis, and malaria. They said that vacancy rate it's up to 71% in the public sector posts in the supply chain. Because the problem, if you don't have a well-trained or well-qualified personnel on the supply chain, it will be catastrophic. That's been from the very beginning up to the end, it will be catastrophic. You will have a person unable to manage all the activity of the supply chain. And the consequences are severe because at the end, if you cannot bring the right medicine to the right person, you will have that person at the end. So it's very important to have very qualified personnel in the supply chain. Next slide, please. Let's take an example. You know, all of you, you know what is API, active pharmaceutical ingredient. And during the COVID-19, you know what's happened. What you have to know, it's 80% of the API are coming from China. And where from China? From Wuhan. Do you know Wuhan? It's where the COVID started. So when China and Wuhan closed the border, you don't have any more API available. And what's happened? India, they are sourcing 70% of the API from China. So when there was no API available in China, you have no API available in India. And when India closed the border, no more medicine, my friends. So it was catastrophic. Next slide, please. That's why you need trained people, and not only on supply chain management, but on risk management. I don't want to say and to tell you that because you are well trained in supply chain management and risk management, that you can avoid the COVID-19. It will be a nonsense. But when you are trained in the supply chain, you are trained in risk management. That means you can mitigate the risks. That means you can mitigate the negative consequences of the COVID-19. So that was very important for the professional of the supply chain management who knows how to manage the risk. They could mitigate the risk of the COVID-19. So the question is, do you have this kind of training, or do you study that in your school? I'm not sure. If it's the case, congratulations. Next slide, please. When you learn about supply chain management, you learn about risk management. It's interlinked. It's very important to understand that. Supply chain management, risk management, all together. Next slide, please. So as I said, we don't have a lot of people with these skills because the problem we are facing is very few schools of pharmacy, nursing, or medicine teach procurement and supply chain management. Very few management schools teach public health. So no finance, IT, transport courses, law schools teach public health. So the problem is we don't have the right courses or curriculum in this university. And it's what Empower try to do right now. That's been to set up a new curriculum in some university to teach supply chain management and risk management. Next slide, please. Why we don't have trained people? It's very simple, because we don't have very accurate training. You know, all of you, what is a training? Sometimes you fall asleep. After 10 minutes, you don't care about what the speaker is talking about. And we don't have the correct mechanism. We don't have the correct courses. We don't teach the correct activities. We don't teach the correct topics to the students. That's why we don't have well-trained people. Next slide, please. All of you, you will say yes, but why to learn about that? We have technology, and technology will take over soon. Do you think when you have COVID-19, you go to AI, ChatGPT, and say, Okay, guys, what can I do now? Hey, ChatGPT will say, I don't know, because everyone has its own context, his own situation. So the technology will not take over soon. Next slide, please. And on this slide, you see that the company, the private sector, they said, yes, we need technology, but we need people. Technology for sure will help and support the people, but we need the people. We need brain. We need people who can take action right away. You can think, it's very important to have people. It's very important to have leaders. Next slide, please. What we teach, for example, in Empower, or what you will learn in supply chain management, it's a multidisciplinary approach. What does it mean? That means you will not become a lawyer, but you will learn about the law. You will not become accountant, but you will learn about how to let's say, to have an audit trails impact, how to understand inventory management. You will not become politician, but you will learn how the need for good governance is very important in the supply chain. You will not become statistician, you will not become economist, you will not become data or expert computer. No, but you will learn all of this. All of this you will learn about. Next slide, please. And moreover, you will learn how to become a leader, a teamwork, how to work with cooperation, coordination, with trust, with effort, definition, achievement. Next slide, please. What we want in a management of supply chain, it's leader. We want people able to lead, to change things, to have a new approach. When people are leading, people follow. If you don't lead, people will not follow you, will not listen to you. So what we try to do is to build leader on supply chain management. Next slide, please. So we need leader, but we need manager. So the leader needs to manage and the manager needs to lead. So we will need both of them. Next slide, please. In conclusion, there is a nice sentence, which is half from me, half from someone else. There is always a difference between doing a job and doing an excellent of it. It's training on supply chain management, because each training you will have on supply chain management will drop you up. That means you will become better. Your knowledge will be better, and you will be able to lead, to become a leader. So believe me, training in supply chain management, it's one of your opportunity, but challenge. Why challenge? Because it's very complex. Thank you very much.
Thank you so much, Nicolas. Some very good insights into how pharmacists can get into supply management, and the pros and cons of doing supply management is one of the areas much needed in East Africa. So we're going to wrap up and give some conclusions. I give each panelist 1 minute to give their parting shot. We start with Jacques. Sorry, yeah, we'll cut to the president last. But Jacques, your parting shot.
All right. Thank you very much. First of all, I would like to thank the attendees and even the FIP for this event. It is a massive event, very impactful. And with more of these events, we will leverage all the resources available, not just for East Africa or Rwanda, but across the globe. So FIP keep updating us on the opportunities available, and we hope that will help us to mitigate the challenges faced. We thank you on behalf of Rwanda National Pharmacy Council, and we thank you on behalf of the East African region as well. Thank you.
Thank you, Jacques. Parting shot, Dr. Konje.
Thanking all the participants and thanking FIP for arranging this kind of meeting. We should have more. A parting shot for the participants is to say change is the only constant, and we should be embraced to be lifelong learners so that we can remain relevant as pharmacists, as practitioners, but also meet the ever-changing needs of our patients and the healthcare systems in our countries.
Thank you, Dr. Konje. Kidu, your parting shot.
Thank you so much. I would like all participants and particularly the FIP to extend your support for more rigorous advocacy in Ethiopia for the establishment of Pharmacy Council, which we are very eager to have it because we know how much it values to our profession, the quality of education, and to the quality of service, pharmacy service that we aspire to have in the country. So I call upon you, all of you, to extend your support in Africa, also neighboring and in Africa and FIP all. This is one thing. The second thing I just want to make is that I think let's take the initiative to have more frequent webinars and discussions of this type, so that we can bring our service more closer and solve our problems in a more efficient manner. Thank you so much.
Thank you, Kidu. Stephen, 1 minute parting shot.
Okay, thank you so much, dear the fellow panelists and the participants, and in a special way as Pharmaceutical Society of Uganda, on behalf of the council, we want to thank you for the support the FIP has always given to PSU, and we look forward to more collaborations and support. To all my colleagues in attendance as pharmacists, let us be doers and not lamenters. It is time to act. A strengthened system in a member country you are not safe in that country when your system is working and the neighbors are lamenting or having issues. You should take initiative to come and support. Go then and see how to support also in other settings. Let us embrace partnerships in doing business as pharmacists, because pharmacy is both a profession and a business. So let's get engaged into business as well as pharmacists. Let's do this as partners across the region. And those seeking employment, please do not forget to sign an employment contract that will guide you, because at the end of it, it will help resolve any labor disputes that may arise. Let's be assertive. When you talk of the supply chain management, let us make sure that we are the ones populated along this supply chain. There is no strengthened supply chain without a pharmacist, and therefore we should all work together to ensure that pharmacists are fully within all the public health facilities of our region, and also they are in charge of the molecules within the community pharmacies. Please avoid absenteeism. If you're a pharmacist who absents yourself from the premises and you don't want to work but you want to earn, I want to implore you to change that attitude, because it is against the spirit of safeguarding the molecules and the public. I want to thank you all for attending, and I want to thank all the organizers and look forward to more engagements. God bless you.
Thank you, Stephen. Parting shot, Jocelyn, President APF.
Oh, sorry. Yeah. Thank you so much, Aneez, for leading this, for facilitating this webinar. Just quickly, there are some questions which are in the chat box. And one which I found of interest for me is about depression among pharmacists. Maybe some of these things, they come because of lack of career guidance, which happens when kids leave high school. So as pharmacists, while we're practicing, we should actually start off by giving career guidance for those who want to join the schools of pharmacy. And when they're in the schools of pharmacy, let's be mentors for the young pharmacists. And I encourage them to join groups where young pharmacists encourage each other, like the Afro IPSF, which is going to be in Zimbabwe this year, 2026. My president for the IPSF Afro is working really hard, and we invite you to have a nice time here in Zimbabwe for the IPSF to the young pharmacists. The IPSF International Conference will be in Kenya, so you're also invited to be there. And then from there, FIP, I'm sure Desire, Genuine will talk about that one. And then student exchange, it's to encourage us as supervising pharmacists to, when students association plan these student exchange programs, let's be there and be their mentors for the young pharmacists. Then harmonization, it, as someone was talking about, there's the Schools of Pharmacy Association, which is coming up, and is to try and harmonize education. The regulators are ahead of us. There's a harmonization in this, like in SADC, we've got a Zazibona, we've got the countries there are registering medicines together. But when it comes to education, each man for himself and God for us all, which is what the attitude we need to change so that we are all pharmacists, wherever we are, it's one FIP concept, one pharmacist practicing everywhere in the world. Thank you.
Thank you, Madam President. My parting shot is that we are here to help whichever area that FIP needs our help with. I have heard that we should do more of these collaborative learnings. So I challenge Genuine and your team to set up a webinar at least once a month or once in 2 months for East Africa under APF or for Africa, and try and get topics that are mutually beneficial to all. We already have some ideas as to where we want to go. Secondly is to extend an invitation to all of you to attend the Pharmaceutical Society of Kenya conference coming up in June. We will be sharing more details with you and look into how we can strengthen the East African Pharmaceutical Society, or a concept thereof, a similar concept. And if we meet, inshallah, we meet in Copenhagen for FIP, we can look into how we can do an annual Africa FIP conference. With those parting shots, I hand over to Genuine to wrap up and also talk a little bit about the work that is happening with the curriculum development. Thank you, and God bless.
Thank you.
Thanks, Aneez, and thank you all for such a wonderful session. As we come to the end of today's session, I'd just like to extend a very huge thank you to all our speakers and panelists for sharing their valuable insights, and to all of you for your attendance and for joining us. We really do hope that you found the discussion very informative and inspiring. Before we sign off, just a few quick reminders that if you'd like to go back and look at the recording of this webinar, and as well as check out any future digital events, please go to events.fip.org, and you can also sign up to get email reminders of upcoming digital events. Additionally, I'd like to highlight that we'll have our 83rd FIP World Congress of Pharmacy and Pharmaceutical Sciences in Copenhagen, Denmark, from the 31st of August to the 3rd of September this year. Registration for it is open, and for more information, please visit the Congress website on copenhagen2025.fip.org, or just simply scan the QR code at the bottom of your screen. Once again, thank you for being part of today's conversation. We appreciate your time and engagement, and we look forward to seeing you all at our next session, hopefully organized by the African Pharmaceutical Forum and our president, Jocelyn. Have a great day or evening, and take care. Bye for now.